following video represents so much that is wrong with our healthcare system. Chesapeake General Hospital is being sued by 500 patients. And the reason for this lawsuit is that one of the doctors, prior doctors, Dr. Pervez, who was an OBGYN, is serving 59 years in federal prison for Medicaid fraud. Now, Dr. Pervez, who perform unnecessary procedures. He would remove organs that didn't need to be removed. He would sterilize women without consent and without their knowledge. He would also induce labor to suit his schedule, and labor and delivery nurses will know what that means. You know, there are many people, there are many doctors that tries that. And one of the most egregious things that he did was to backdate consents to cover himself. He also misused patients on Medicare, because most of his patients were Medicare patients, and he would bill Medicare for procedures and things that were not done. In addition to this, hospital staff were speaking out, nurses, doctors, anybody, everybody that was impacted by the type of care he gave was speaking out. But the hospital totally ignored this. Now, one of the reasons a hospital may ignore reports about a physician is because that physician is profitable for the hospital. And once again, I have seen this in my own career. And now with the lawsuit, they also named the CEOs and previous CEOs, which is Win Lawton Dixon, Peter Boskov, and John Reese Johnson. I cannot emphasize all the things that are wrong with this. The backdating of consents, performing procedures that the patients did not need, admitting babies to the NICU that didn't belong in the NICU, all in the name of money. So as nurses, once again, when we see something, we have to speak up and we have to educate our community, because everything could have been prevented if the hospital administrators have just listened to the people who were reporting this doctor, but they didn't listen because this doctor was making money for the hospital.